What's up, beautiful people? Another day, another study. When I was working in the hospitals, one of the things I would do when patients came in with severe respiratory tract infections was check their vitamin D levels. I also do this in the clinic whenever patients say that they get a lot of upper respiratory infections, they get a lot of colds. I check their vitamin D levels, and often they were low. I started doing this years ago when I started to see evidence associating respiratory tract infections with low vitamin D levels. So respiratory tract infections are a common reason people present to outpatient primary care, urgent care, and hospitals. Previous observational studies have shown a link between low vitamin D levels and respiratory tract infections. However, some relied on self-reported infections rather than objective diagnostic techniques. We know that vitamin D is very important for immunomodulatory functions, for our immune system, and the defense against both bacteria and viruses. It also helps prevent the immune system from causing too much destruction. So it helps with toning down the inflammatory response when it's necessary, when we don't need to fight off the infection anymore and we're in the recovery phase. A previous meta-analysis indicated that vitamin D supplementation reduced the risk of respiratory tract infections in adults and children by 8%. This study used data from the UK Biobank on a diverse cohort to assess the association between vitamin D levels and RTI, respiratory tract infection, hospitalization risk. And they saw that higher vitamin D concentrations were associated with lower risk of respiratory tract infection hospitalization. Basically, for every 4 nanograms per milliliter increase, the risk of respiratory tract infection lowered by 4%. Those in the lowest group of a level of around 4 compared to around 30 had a 33% higher risk of hospitalization for respiratory tract infection. So overall, this goes along with the body of evidence linking vitamin D with increased respiratory tract infections. Now, there are limitations such as an observational study. It's not generalizable because the population was in the UK. The UK Biobank also suffers from a little bit of healthy user bias. Usually in studies like where you voluntarily sign up, healthier people tend to volunteer rather than sicker people. That's just how it goes. And vitamin D was only measured once. Another thing that's important when you look at this is not just were people hospitalized, but what are the outcomes of those hospitalizations? How many people got sent to the ICU? How many people died? What was their length of stay? All of those things matter as well when you are taking care of patients in the hospital. So it'd be interesting to see data on vitamin D and that as well.